I've got 12:16 on my clock. Let's go ahead and convene as the Board of Health. Number one on the agenda, item number one on the agenda is possible adoption or revision of health officer order on COVID restrictions as a board rule. Ellen's going to walk us through that. We're going to have a public comment on that and a public comment process on that. So as a preliminary matter, Julie, could you kind of walk us through how you're going to handle the public comment in terms of identifying attendees that want to comment, giving me a heads up and the board a heads up as to about how many commenters we have so we can keep an eye on time, things like that. Julie, could you just take a minute to let us know how you kind of from a technical standpoint, procedural standpoint, how we're going to kind of keep track who's going to provide comment and handle that.
Yes, thank you. This is Julie Moore. I'm the Support Services Administrator at the Health Department. We have basically 3 different ways in which we can identify individuals who want to offer comments. First of all, Ross as chair will announce when he's ready to take comments. So you'll need to listen for that opportunity and hold your comments until that time. For those of you who have joined the meeting using the Teams application, you'll see an icon bar. It may be at the top of your screen, it may be down toward the lower portion of your screen. One of the icons looks like a hand, and if you hover your mouse over that icon, it says raise your hand. The first way that we'll call for identification as to who wants to give comments is for Ross to tell you, use the raise hand icon if you have it. You just click the icon and then we'll be able to see which individuals and therefore how many individuals would like to give comments. Now, not everyone will have that icon. If you join using the web browser and not the app, you don't see that icon. So we'll also, at a moment in time, ask individuals to just identify in the chat that you would like to also give comments. So you've got a chat icon on that same icon bar. If you hover over it, it looks like a little balloon with some lines of writing. It's called Show Conversation. When you click on that, then you'll see the chat window open up, and down toward the bottom of that window, you can just type in, you want to comment. And then lastly, if there are individuals who are joining by phone, we'll be able to see your phone number. And when we've gone through those 2 other efforts to get comments, then we'll call the different phone numbers. We'll identify the different phone numbers. You'll need to unmute your phone and indicate at that point if you would or would not like to give comment. And so we'll just take turns going through all the individuals in this manner. Thank you.
All right, thanks.
I'm sorry, Ross, one couple more things. We do ask folks, please mute your mics or your phones when you're not speaking. If you're calling in by phone and you're not sure how to mute your device, use *6 to mute. And then during the public comment period, press *6 again to unmute. And then we also ask individuals, please turn off your webcam cameras unless you're speaking. Thank you.
All right, thanks, Julie. Well, with that, we'll get started with item number 1, and Ellen's gonna lead us through that possible adoption of the health officer order on COVID restrictions as a board rule. So Ellen, go ahead.
So I'm going to start with the briefing on the key indicators, which is how we now start all of our discussions. We've had 2 committee meetings with the board COVID committee since we last met. And I have updated the key indicators to reflect today. So I'm going to put the first one up and try the share button. Okay, are you able to see that chart?
Yes.
Yes.
Okay. All right, these are our usual key indicators. I have made some changes, as I said I would, as things change in our system, both our epidemiological data system on the ground, and also we have a major change up in our case investigation contact tracing system, which are affecting our indicators. So 3 types of indicators: the epidemiological, the resource availability, and indicators that suggest how we are doing as a community with mitigation efforts. So as we're all aware, our epidemiological profile, we either we can be ascending, flattening, or descending. And of course, the goal is to descend, or if ascending, to flatten. We do continue to ascend. Over in our, so we have a red, we have green, yellow, red. Over in our right-hand column, this simply compares us to last week. That's all the right-hand column does, so they don't have to put a bunch of charts in front of you. So we are ascending. Our key indicator, which is our goal, comes from the Global Health Institute convened by Harvard, and points to having a daily incidence rate of new cases using a rolling 7-day average per 100,000 population. So with Missoula County, a little over 118,000. The key indicator that we have surpassed, which you are not to surpass if at all possible, while trying to mitigate spread, is equal to or less than 25. And so, as you're aware, the health officer's order went in at the end of October 27th, after consultation with local officials and the COVID board, because we had exceeded 25, but not by much, but we started exceeding it more rapidly. Since that time, we have gone up as high as over 70, I think 76. I am glad to say that for 3 days in a row, we've actually been getting better. It's not long enough with a 14-day incubation period to call it a trend, but we are at 67. So coming back down for several days right there. Still it's red because we are above 25 incidents. Our RT, our transmission rate, continues to stay at least slightly above 1. At its peak, when we spiked, it was 1.67. It has come down considerably, but it's still running just above 1. Sometimes it moves around a little up to 1.05, at worst 1.1. But with the number of cases that we have, every little fluctuation in the RT rate will generate more cases at this factorial, basically. So we are better on that, but we are not below 1, which is, of course, the goal, is to get below 1 and stay there. We are holding pretty well, but seeing some movement in the last week, a little bit of worsening on the other metric that is important to watch, and that is the percentage of cases that are identified as having been exposed by a known case. So the close contacts, so the case management, case investigation, contact tracing. And the Harvard Global Institute goal for that is that at least half of our cases need to be identified in that fashion, as opposed to just community or unknown spread. And we have remained in the 60% or greater. Just in this last week, we dropped to 60%, but we're still in the green on that, even though we're worsening a bit. In the last week, I would say a worrisome change has been we have slowly been creeping up to 10% of our test positivity rate. Again, that's another Harvard mitigation indicator that we are comparing ourselves to, but we were slowly creeping up and at the same time adding testing. Last week, we were a little over 12%. Unfortunately, we increased by almost 50% up to 18%. So we have worsened. We are still below the state average. This, however, is an indicator of two things: more infection in the community, and very importantly, we need more testing. So we have expanded testing even before this happened. We now do evening testing and partial weekend days, and we will expand to a full day, 7 days a week. In the past week or a half, however, some of the testing materials that we need are becoming in short supply, so we're scrambling on that. The state rate is, I think, about 27. I'm not saying that that's good. I'm just giving you comparative values. Test turnaround needs to be 2 days. Now, our quick tests, of course, are our quick tests, and we can get those the same day. We manage that. Those are the supplies, however, that we're having a national supply chain problem with. We have increased our testing to about 170 people a day, and just in the last week or two, we have had the state lab divert some of our tests, the ones that have to be analyzed as PCR in the lab. And this has worsened. And on average now, they're coming back at 72 hours. So if they get longer than that, that's really difficult in terms of getting a person in their contacts isolated and quarantined. Knowingly, anyhow, many people will agree to stay isolated without the test result. We've had a major and planned change up here. I actually don't have the data for this week. Last week, we were running in the yellow because we were managing to hold on to the front end of the case investigation contact tracing pipeline in terms of getting people in at least within 3 days. But we really need to start that process within 24 hours of receiving a report, and then it has to carry on through contact tracing. As I've discussed with the committee, and I don't believe the full board, we had a major migration that we're still completing to an application called Sarah Alert that was developed by and for public health workers specifically for this purpose. And that happened over the weekend, and we're still migrating our over 1,000 cases. Because of that, I can't give you the data, but I can tell you we expected it to be worse while we migrated with the expectation that it will be better and more easily measurable in the next week or so. Hospital availability, Missoula is better than most of the total 10 major hospitals in the state. We are looking for either it's open for any type of patient or it's open for a limited way for types of patients and number of beds, or they're on divert. And divert is divert for any reason. Either all your beds are full, your beds aren't full, but you have too many staff out due to the illness, which of course, ironically or paradoxically, happens at the same time that your cases rise in the community, or you divert for a specialized purpose because you need intensive care. So this is not relating only to COVID. This is relating to the hospital being available for any needs, including COVID. We have our one hospital has remained at a yellow level. They also use a 3 color system. Our other hospital remains at green. Most of the hospitals in the state are red or yellow. So Missoula is relatively good, but when it goes up, it goes fast. So we were as high as 44 2 weeks ago. And then we went down to 30 on a 3-day average for admits. And as of today, we're up to 34. Our average number, I've renamed this category and added something to it, as I told you we would be doing. And I do work with the epidemiological team at U of M, as you know, for expert consultation. We are looking for measurements that indicate indications that the different types of mitigation measures, everything from masks to distancing to the different types of school, hybrid activities in school as opposed to full cohort, excuse me. And the two that we think show right now the best measurements, instead of the number of complaints we get, which doesn't really tell you exactly what's going on out there, is we have continued to monitor the average number of contacts among everyone who becomes a case, and it is staying around 5. So it goes 4.8 to 5.2, 4.9, 5.1. When we had a small number of cases, this was good. However, when you get 1,000 cases, you can immediately see that you have, even though you haven't discovered them yet, 5,000 contacts. So that gives you a sense of why contact tracing is, our system gets overwhelmed. And the two major risks that are identified in the Harvard Global Health Index about being overwhelmed is that you will overwhelm your contact tracing health department system as you get above 25 incidents, and you, of course, risk overwhelming your hospital, depending on hospital size and location. The new one that I've added, it's not that we want to say that our incidence rate is great. It is not. It is over 25, and this is actually wrong. This should be at 67. I didn't change this. This number should be 67. This is from yesterday. That said, I do keep track of where we are in the state in relation to the state average for case incidence. And we have remained below the state average, so we are not even in the lead among large counties in terms of incidence rate, especially as we're dropping down a bit here to 67. So I put us in yellow. One other thing I want to show you, if there's any questions, I'll stop momentarily. Any questions from the board, clarifications or comments? Okay, I will quit sharing this one and put up a different one.
Helen?
Yes.
This is Amber. I didn't know if we wanted to raise our hands or what we wanted to do. Could you speak to how capacity in the other large hospitals around the state, how does that affect us? Like, what is the relationship there?
Well, we're one big system, not just in the state, but regionally. And so there's a pretty complex and very well-oiled system for diversion between our state hospitals and regional hospitals, and also to hospitals that have very high-level acuity specialty care, such as Harborview or Salt Lake or Denver. And so with those very different tiers of what the need of the patient is, but all the way down to a more basic hospital level, like, can you accept somebody in your regular medical unit, for example, delivery of babies, intensive care for maybe heart attack, necessary surgeries from trauma. All of those enter into the picture, and the more specialized and urgent, of course, the smaller you head toward the top of the pyramid of the type of care that's available. So even though we are populating our hospital when we have the COVID admits, they've generally run about half of those admits are actually residents of Missoula County, and the other half are from elsewhere in the region or the state. So certainly, as we've seen hospitals in central and eastern Montana, and now in northern Montana and Kalispell, as we've seen those hospitals be in the red zone for some of them months, and certainly more of them in the past weeks, some of those diversions are going to come our direction. Relatively speaking, it's very, very difficult to even have the number of COVID patients that our hospitals have had. It's very difficult. So it's only in relative terms that I say to you, ours aren't at red, ours are at yellow or green, and others are at red.
Thank you.
One of the new charts we've come up with is, if you take that daily incidence figure that we have set as our goal, and our goal set by the Global Health Institute is to not be above 25 new cases on a 7-day averaging, because otherwise it gets very sawtoothy, per 100,000 population. So this is where we were at the beginning of September, well below that. And as you remember, our indicators and our case numbers were, we were basically dry for cases back in here, which is great. Started ticking up a little bit. And then we saw this, and it was right about here when I started working with the board committee, and right in here is this reflects a lot of our overall growth, but also our long-term care outbreaks that we had, and that also, you can see that reflected in our recent peak in hospitalizations, which went down and is now rebounding. So right in here is when we put the local health officer orders in, and it's a good time to state for the general public that there's two authorities. There's the health board authority and there's the local health officer authority. They work together, but the health officer authority does allow that quick action and by order. And what we're doing today is we're trying to move some of that, because obviously we're going to need to be in some restricted state for a good period of time unless this falls down. We move that then to a board rule, and the full process that we are offering and going through today. But one of the, again, relatively good things about this is, even though you see this squiggliness, when you put a little trend line here to try to get the shape, we are not experiencing perfect exponential spread. We are definitely pushing down against what would otherwise be a perfect exponential spread of a profile. But we are still experiencing growth. So I want to say those two in the same breath. And so we can follow our little trend line here, which is more of a linear looking line than a curve. And you can see kind of the up and down that we've got. This is why it's nice to see this go down and kind of come back to where our line projection says, if you want to stay on this line, that's where we're at. But it's not, it in and of itself is not a trend. It's just not worse, okay? So this, again, is relatively good, but we are well above what is the goal area and continue to be at risk of uncontrollable spread. Any questions on that? We will continue to produce and post this graph every day so that people can track from day to day. Okay, well, thanks to the U of M epidemiological team, our own staff who participate on the team, and the situational awareness and the data team, because it takes an awful lot to create this data and then vet it and then put it in a way that it can be public facing and useful.
Ellen, this is Josh. I just want to ask you a quick question.
Mm-hmm.
What sort of numbers would we have to hit before you deemed this uncontrollable or out of control? I can't remember the words you just said.
Yeah. Well,
Thank you.
yeah, that's hard to answer. When you start, one of the, I'm going to give you little pieces of an answer because if you just look up in a textbook, what does exponential look like? You're gonna see the curve, you're gonna see the peak, and you see the same kind of curve going on the other side. And obviously, we're not exactly looking at the right chart for that. I would need to put the number of cases up to show you that. But then you'd start seeing things like your cases are doubling. You might remember back in the spring, New York City, cases were doubling every 3 days, cases were doubling every 4 days, every 5 days. Remember that? That was incredibly alarming, just incredibly alarming. We are just starting, our epi team is just starting to look at something like that, which how many days of between case doubling. And right now they're not ready to put out a number. We will be revisiting that on Tuesday. But I can tell you, and you can tell just by looking at it, it's not even every week, right? So we're definitely pushing down on that. And case doubling also has, some of it comes out of the incubation period being so long. So we know we're pushing down on that. It's very hard, though, to actually measure as you're going through it, let alone after you get through it, which is really epidemiological work, how to measure what are considered counterfactual. Those are the cases that didn't happen. So if you could put that perfect exponential curve up there for this particular disease, which we're still learning about, and then you could show your own indicators. In between those two profiles would be the ones that you could consider you've prevented or slowed. I don't know if that helps at all. When we start looking at case doubling, and if we get anywhere near looking at case doubling every several days, that will be extremely alarming. And it can happen, and it has happened in the country. Can I take this down then? Okay.
This is Rob Stinger. There's one more question in the chat that might be worth addressing. And I believe the question is, they're asking about growth in the incidence of new cases in the county compared to how quickly our testing is going up. I know that that's been a theory out there that we're just seeing more cases because we're testing more. And yeah. I believe that is absolutely not the case in Missoula County. We are testing more, but new cases are going up faster, and the percentage of positive tests is going up faster. But you're a little bit more on top of the day-to-day data. Could you speak to that?
And actually, one of the indicators, the one that I mentioned I was worried about this week, we went from 12% test positivity, which we had slowly worked our way up above 10%, which is the demarcation. And in a week, we went to 18%, despite having expanded some testing. So that tells us we need to be doing more testing, because yes, there is a relationship between how much testing you do, but when you look at all the number of indicators that we see, there is not a direct relationship that you test more and you find more. That is just not the case. It's much more complex than that. And I don't know if that helps answer that question, but that test positivity indicates more infection rate and the need for more testing. Okay, so the proposal in front of you, we've worked with the board committee twice, once to put the order in place in October, and then again to prepare for this meeting and actually offer up some revisions, some of which are cleanup revisions, some of which are, well, we've learned, it's like anything. We put it out there, we tried it, we need to improve it. And also, I know the public and other members in the community and the board were apprised by us of some work that we've done with members of the community, and that is not at all unusual. We worked with the farmers market in the past. We worked with the events coordinators. We work with the schools, and we learn from them the best ways to do things and keep them in at some level and a high level of safe operation. So some of our revisions were in fact to bring some of those iterations to you. In the meantime, I actually didn't realize this, but 3 other local health boards and officers adopted parts of our health order, not all of it. They did not look at the retail aspects that we are trying to work on here in Missoula, but they did look at the bar aspect. And then the governor and the group size, which we reduced to 25 in the health officer's order down from 50, and put more aggressive requirements in our planning requirements and our plan review, which has worked well for us in this community for protecting environments. And our local evidence does show that the protective environments are in fact have a level of protection as opposed with lower cases clustering out of there than you see with the unprotected social environment, unstructured, I guess is probably the better word, the unstructured. In the meantime, the governor made an announcement on Tuesday, which was about the time we were taking written public comment, and we did continue to get that public comment. And right after my talk, that will be what was brought in writing will be presented to you. We did it that way because these meetings are difficult for everyone. We do have to move quickly, but we wanted to get public comment as much as we could possibly get. So you will get a summary of the written comment, some of which was written before the governor made that change and made part of our revision moot. So with that, what I want to lay out for you in terms of process is you may be able. When we first were going forward, I felt pretty strongly that you would need to act today if you felt that you could come to a conclusion and act. With the governor making the statewide directive that he did, it is less urgent because my health officer order is still in place and we still are operating on it. And we also have to bring you other rules in December. So it's less urgent that you act today. You can be more deliberative. And I know that you may well want to be, because the board itself, this will be the first time the full board is able to hear all the public comment as well as each other's deliberation. But the overall process that we are starting to move toward is we will be losing the governor's directives when this governor leaves. And we are doing that at a time that cases are going up across the state. We do not know if or what directives will come from the new governor, and even if he did plan some, I know he's putting together a task force, I'm aware of that. We need to bridge our community, not only in a basic minimal way, because it's a high populated community that houses a very important a regional medical hub. We have to protect that as well. But also because we just don't want to go into some hiatus as our cases are rising. And then we can still, I can still, as a health officer, as need arises, consult with the board committee thereafter and elected officials and leaders and other members of the community if I need to act more urgently and put more stringent recommendations in. So I at least need a good framework from this board to work from as cases rise, as the community is put under more pressure, particularly since the money from Congress is not coming forward. And it's very difficult to have particularly small businesses try to hang on and cooperate when the money's not coming forward. So the part of the governor's announcement that said he's going to put some money forward despite not having money coming from Congress is helpful. But that, until that money comes forward, it's going to be very, very difficult for people to cooperate. And I appreciate that they are cooperating. And then, of course, we're all aiming for trying to continue to slow the spread as much as possible until vaccines can start. And even when they do start, they won't be available for the general public. So we're looking at many months of holding on and holding down. So that's the process pathway that we are on. And what I'd like to do is ask Shannon to give you the presentation on the proposed board rule. And then right on the heels of that, our PIO and her team, Mary Parrish, have made a short PowerPoint so that you and the rest of the public can learn what written comments came in before you take the in-person comments that are on our meeting today. So, Mr. Chairman, if I could, I would then defer over to Shannon Terrio unless there's other board questions.
That sounds like a good plan. All right.
Thank you.
Thanks, Shannon. Take it
Thank
away.
you. All right. Thank you, Rouse. Thank you, Ellen. My name is Shannon Terrio. I'm the Director of Environmental Health, and I'm going to present the proposed rule by the proposed Health Board rule. I too have a short PowerPoint that I'm going to start. Oops, but I have to share my screen first. Give me one momento. Here we go. All right. And there we go. Okay. So for the benefit of those in the audience, I know that the health board already knows this, but I want to put these rules in context first. So the governor established some requirements for reopening after his statewide stay-at-home order. There was a phase 1, and then there was a phase 2. And since phase 2, we've been in phase 2 since June 1st. And those phase 2 requirements of the governor did create requirements for businesses and events. And then locally, we have had a health officer order that has changed over time to address gaps and local processes. And then once the cases started going up, as Ellen has already said, the health officer, she worked with the health board and community leaders. And then this is the new, since October 27th, we've been working under a new public health officer order. And what that order did is reduce group size from 50 to 25 for events and gatherings. It also changed some of the event and gathering requirements. So originally in Missoula County, if you had an event that was over 50 people, it had to be highly structured. Now, if you have an event over 25 people, it has to be highly structured. It used to be that, if you were going to have an event that was over 250 people, you had to have a written plan. Now, every event over 25 people has to have a written plan. It used to be that if you had 1,000 people were going to come to your event even if it was over the course of a whole day or 2 days, you had to submit the plan to the health department and get written approval from us before you could hold your event. And now that has been reduced to, if it's going to be over 250 people, you have to submit it to us at least 10 days before and get written approval from us. So that's what's in effect right now. It also reduced the capacity in So retail stores and bars and restaurants, gyms, places of assembly like theaters and bowling alleys and pools, all had to, well, take pools out because that's a special group. But they were at a 75% capacity cap. And then the health officer order took that down to 50% capacity to reduce the crowding and to enhance the ability for those businesses to spread people out, for customers to spread out within the businesses. And then also that 1027 order, which is in effect right now, closed bars and alcohol service in restaurants by 10 p.m. So that is what we have in effect and how it was different from what was in effect previously. And so with this proposal, essentially we are recommending, staff is recommending that the health board adopt the health officer order that is in effect now with some changes. And those changes include, so right now, if you are having an event over 250 people, you have to submit your plan within 10 days. At least 10 days before the event or gathering. However, if you're having an event that's between 25 people and 250 people, which, by the way, is the majority of the events that we look at are in between 25 and 250 people, you have to contact the health department. But there was no, and then you have to submit a plan if we ask you for your written plan, so that we can help review it and help guide how to meet Appendix A. And there was no day by which that you needed to contact us. So really this is about managing expectations, because when people would call us the day before, there really wasn't time for us to give good guidance, or even more importantly, for the event organizers to make the changes that they need to make in order for that event to meet Appendix A. And Appendix A is that the event has to be highly structured. You have to have a way to keep sick people out, workers and participants. You have to have an enhanced cleaning and sanitization plan. You have to have a way for people to be able to identify what close contacts they might have from that event. And there have to be ways to keep people 6 feet apart, unless you were in a pod, and so of a certain number of people, 25 or less now. And so what we have found in our many months of reviewing event plans is, and talking with people about event plans, is the concept of what a highly structured event is. People, they start having ideas about how they could structure an event to keep groups in 25 or 50 person pods, which is what it was before. But they really don't understand how structured is, and really what it takes to meet the health officer order and that appendix. And so I think our conversations with people who are wanting to have weddings and wanting to do even smaller events have been very beneficial in ensuring that they really understand what it means to have social distancing, enhanced cleaning, and keeping sick people out of those events. So anyhow, long explanation, but we would really like there to be a 10-day notice for events and gatherings. I also want to tell you that we understand that it doesn't always happen that way, and we do our best, of course, to review events and gatherings that would be less than that 10 days. But again, it's about managing expectations so people can understand that at some point it's just too close to the event and they won't be able to make changes necessary to keep people safe and have more than 25 people there. The other thing is that it clarifies the capacity limit requirements for retail, gyms, and places of assembly. So it doesn't change the 50% cap, but it does have some clarifying language. Our recommended changes have some clarifying language about what that really means and what retailers really need to do, especially the really large retailers. And so that we already were putting forward that expectation that you had to determine what that capacity is, what that 50% capacity is. And now we're saying that it needs to be determined and posted, and they have to have the ability to know how many people are in their space at a given time, and to be able to restrict people when you are reaching or are at capacity. And so that's how we were applying it, but we wanted it to be very clear in the rule, if possible, so that people who read the rule can understand what they are obligated to do. Then, as Ellen brought up, the governor came out and 2 days ago and had some additional restrictions. And so in the health officer order from the 27th, it closed bars and alcohol service. The governor's order also closed restaurants at 10 p.m. And so we've incorporated that and that change into the latest version that you have. And then the other thing that we did is, Ellen alluded to that we need to have these phase 2 directive, the governor's phase 2 directive requirements in place in Missoula, so that there's some continuity for our establishment, so that they know what's going to apply to them, and so that there's more certainty as the governor changes in Montana. We did that for bars and restaurants in this draft, but did not yet do it for the other types of businesses that the governor includes in his phase 2 directive. And so that's something that we intend to do for a later rule rewrite. So that, and to kind of make it the same as we have for the personal care businesses, we just referred to an appendix. So events refers to Appendix A. Personal care businesses, and by that I mean like barbers and salons and manicurists and tattoo artists, body artists. That's Appendix B. Appendix C is a retail plan, and now Appendix D will be the requirements for bars, restaurants, breweries, distilleries, and casinos. And then there's also, we want to clarify, there's a line in the health officer order right now that talks about school-related events. We want to clarify that is K through 12 school-related events. And then in doing that, we want to extend an exception to other sports if they're following some additional testing and safety requirements. And the ones that we looked at were established by the NCAA and the Big Sky Conference. And I think somebody is on the line that will be able to speak to that if board has some more questions about that. And so, as we do, we're putting forth a recommended motion. Ellen said earlier that there is no, that if the board decides not to act today, that's okay. The October 27th rule is still in effect. But if the board does find that they want to adopt a rule today, this is our recommended motion that you adopt the rule as proposed by staff on 11/16/20, which should be at the bottom of the sheet on the piece of paper, that appendices A through C would be adopted as is from the health officer's order from 10/27, and that Appendix D, as proposed by staff on 11/18, which incorporates the governor's latest directive, would also be adopted. I will say, oh my gosh, we have been writing these rules very fast. It's not my preferred method for rule writing. And so you write it, you do the best you can, and you look at it a day later and you're like, didn't mean to do that. So Ellen made some references to talking with different groups in the community, some of whom you'll hear from today. And specifically, we talked with a group of bar and restaurant owners represented by Erica Peterman, who is on the line, and I will be giving public comment today, to look at are there some ways to make bars and restaurants safer later at night so that they could have extended hours and not have to close at 10, but still keep the intermixing of people and other things that were happening in bars that were not safe from happening. And so there was one line in there that there were some additional requirements that we were going to propose when we thought that the bars might be able to stay open as late as 11:30. But that was before the governor's directive came out. And so we took those out. But one of the things that we had been talking about with them is that everybody would be seated in a bar to be served. So instead of having a designated place up at the bar, which the governor's directive allows, that only one person can be at a time, that has to be 6 feet away from any other people, instead of having a place where somebody can go up to the bar and or counter, order food or order their drink and then go back to their seat, everybody was going to have table service. Everybody was going to be served at the tables. And so that line, that second sentence under the first bullet under seating in Appendix D, which specifically says, all customers must be seated or be actively going to a table, the restroom, or an exit. We would like to strike. We would recommend that be stricken because they're also able to get up and order at the bar counter. And they're also able to get up and play bar games such as pool and darts right now. That was something that was going to be restricted if they could have longer hours, or that we were going to propose, rather, they would be restricted if they could have longer hours. They still have to do that in a way, even now, that would keep them, they can't intermingle their groups, and they have to still stay 6 feet away from all other customers. I can tell you that a fair number of bars have decided to close their pool tables for a couple of reasons. One, because it leads to people standing and congregating, but probably even more importantly is it's taking up seating room, and they have to spread all of their tables out at least 6 feet apart. And it's not 6 feet from table to table, it's 6 feet between seated customers. So that takes up a lot of space and almost automatically takes restaurants and bars to about 50%, or in some cases less. So that is the end of my presentation on our recommendation for what the board would adopt under this rule after hearing public comment. And I'm going to stop sharing my screen now.
So Mary Parrish is available to give the summary of written comment. Again, some of it was received before anybody knew about the governor's directive, so, but not all of it. So is it, Mr. Chairman, do you want that to proceed, or do you want to stop for questions from the board?
Why don't we go ahead and proceed with the comments, and then we'll take discussion from the board.
So Mary?
Okay, that sounds great. So I am Mary Parrish. I'm the Public Information Officer for the Missoula City County Health Department's COVID-19 incident response. And we formally solicited public comment ahead of this Board of Health meeting starting last Friday. Let me pull up my presentation for you. Okay. Fairly certain everyone is seeing my screen right now because I have that nice prominent red box around my screen. So I will be presenting the public comment for the board to take into consideration during their formal deliberations. The Health Department formally and informally shared information about this Board of Health agenda and action item, as well as how to submit public comment in advance of the convening today. Of course, the Board of Health meeting is today on Thursday. Public comment was accepted in advance, and as we know, it will be also accepted during the meeting itself, but we thought if we could be a little proactive and make a formal announcement and capture public comment in advance, that would be just a real benefit to the board as they deliberate this particular rule. The window period in which we accepted public comment for inclusion in this presentation was from Friday, November 13th through Tuesday, November 17th at the close of business. That allowed for the communications team to spend yesterday, Wednesday, kind of conducting some data quality assurance, quality control measures, as well as just get everything tracked correctly and then set up for analysis and presentation. So we did share information in a few different ways, the first of which was through a formal press release last Friday. That, of course, was picked up by media partners. And then we did kind of a more informal promotion on our social media account on Monday morning and Monday evening. I'll say in the morning it was more of a general message pointing people to the Board of Health meeting, the agenda and action item, as well as the feedback portal. And then in the afternoon, we did another promotion, and this time we included some specific details as well as a video briefing from our incident commander, Cindy Farr. And that video briefing also spoke to the Board of Health meeting and just provided some general information and clarification kind of around the processes that are part of this, as well as the rule proposals themselves. In addition to that kind of promotion and outreach, the liaison, Stephen Robertson, who is associated with our incident response, conducted outreach from his liaison position. He did that on Monday and Tuesday of this week. And that was because we really wanted to ensure that the sectors that would be most impacted just beyond the general public or residents of the county knew that this Board of Health meeting was coming up. We wanted to make sure that it was on their radar. We wanted to make sure that they knew what was on the agenda and what was a proposed action item, as well as how to submit public comments. So when Steve engaged in conversations or email communications with folks, it was to provide them with information and then point them towards the feedback portal, which is where we accepted that formal written comment. And if they did not send an email to, or excuse me, if they did not submit a form through the feedback portal, they emailed us directly. And so we did make use of our Environmental Health Division's business distribution list. So there are about 1,000 contacts on that. We sent out a BCC email ensuring people's anonymity, confidentiality, privacy, but they got the same general message. And then Steve also engaged in many, many direct phone calls. And those phone calls, again, they either resulted in a direct comment through the feedback portal or an email, so something in writing. But Steve has been working in that liaison role, and it's just been really wonderful to have kind of that relationship building and build a shared understanding between the health department and the community and vice versa about kind of like what's what with the response. And with regards to this particular meeting today, kind of like what's what with this item and what it means if and when the board considers and potentially votes on and either into or not into rule, but just talking through what all of that means so that people really had a good understanding of what they might be submitting comment about. So as I said, most all comments came through the feedback portal, which was on our Missoula Info website. We've had the feedback portal for many, many moons now, probably as far as the summer months. So we're always collecting public comment, and in this case we made that formal and informal announcement that we were specifically collecting comment about this Board of Health meeting. And so because of that, as soon as we sent out that press release last Friday, we added a required field on the feedback form asking folks to indicate if this comment was specifically for consideration in this Board of Health meeting today. So that just kind of helped us on the back end when we started to get into analysis. It just kind of streamlined the process for us a bit. I would probably say like 90% of all of the comments came in through the portal, but otherwise we've had some direct emails, some more formal letters, and voice messages. So between the time period Friday evening at 5 p.m. and Tuesday evening at 5 p.m., we received and tracked 251 comments about this Board of Health agenda and action item. We absolutely want to thank our community for participating. Civic engagement is incredible. It's a really critical part of the culture of our county and our country. So thank you so much to folks that submitted a comment and shared how they're feeling and what they're thinking. And I just wanted to remind folks that we have been and we will continue accepting and tracking public comment regarding the COVID-19 pandemic, as well as our local incident response through that feedback portal. And every so often, we'll probably do something similar to this as other, things arise in the future that we need to bring to the Board of Health's attention. Okay, so let's get into the details here and the data. And so I know I said we had 251 total comments, but often what happens when you're collecting data is you'll have the total number of comments, and then you see some people, they just maybe didn't complete every single field, or maybe they submitted a comment that was maybe not necessarily relevant to this particular topic. So when we look at the comments that were submitted about this particular agenda and action item, there were 242 relevant comments. And I thought it would be interesting just to break out of those 242 comments, 67% were from folks indicating they lived within city limits, and 33% indicated they lived kind of just more in the county outside of city limits. And then if we were to look at the general sentiment of the comment, is it in support, not in support, or unrelated? There was pretty overwhelming support, 70% for the board either adopting the health officer order or adopting the health officer order with revisions. 23% of those 249 comments were kind of generally indicated they were not in support of the board adopting or adopting with revisions the health officer order. And then 7% of those comments were really unrelated, or it was kind of indeterminate which way the person was leaning, and we didn't want to make a determination that was, the writing wasn't there to indicate one way or the other. So some of them landed in this 7% unrelated, unclear. And then this one, I thought it could be kind of interesting or provide some data for you all to consider, just in terms of, where is the support coming from and which part of the county. And so I did this when we presented information about the face covering rule too, and we see a similar trend. So 49% of folks that responded from within city limits were supportive. If we look over here at the red, 14% of individuals that responded that live within city limits were unsupportive. In county, we see 21% were supportive, and 9% were unsupportive. So just wanted to give you a little bit of information based on sentiment, based upon where people are located within the county itself. And if we think about, or look into rather, the general sentiment, yes, there were about 120 comments that were very clearly, yes, we're in support of this. Of those, 17% were just a general yes. And then the remaining comments really just kind of pushed that yes a little bit further, and they ended up making very specific suggestions or presenting very specific ideas. And so we thought it would be helpful to just share some of the highlights of, really what rose to the top. And across these comments, you'll see, I will say that the communications team was a little surprised by how much support there was for something like a stay-at-home order. So you see 43% of the 120 comments that were specifically in support of either adopting or adopting with revisions. They wanted to take the board rule even farther and think about a stay-at-home order. Otherwise, some of the comments that they made included closing bars or ending indoor dining and returning to takeout only. And a lot of folks were also interested in reducing group sizes. And just as a reminder, we've said this a few times, but please remember that some of this comment was sent to us before Governor Bullock spoke. Okay, so who did we hear from? We heard from residents of the city and the county. We heard from business owners as well as staff. A lot of concerned employees out there, as well as business owners, and understandably so. We heard from frontline workers, essential workers, healthcare specialists, and healthcare facilities. We heard from some government sectors, and educators in schools, including sports athletics teams. And so after reviewing the comments, and again, keep in mind that this is kind of in a short window, short turnaround time. And so if we could certainly always do more thorough analysis, but I wanted to let you know that after reviewing all the comments and reading them in context, it became really evident that we needed to be very clear about what a yes meant or what a no meant. A yes meant that the individual was supportive of the Board of Health adopting or adopting with revisions the health officer order from October 27th. A no actually indicated, it could indicate, it primarily indicated no further restrictions is what I was reading, was please no more additional restrictions, which is a little bit different than a straight no. So there were some people that were saying, please do not add additional restrictions. And then there were other people that were of the mindset the board does not need to adopt the rule, or excuse me, the health officer order. The health officer order can stand on its own. But I thought it was really important to just kind of make that distinction of a lot of the no's weren't necessarily unsupportive of public health or the current restrictions. They were more of the please no more restrictions. And there were really only a handful of comments I would say less than 10 that very clearly indicated, hey, we want all of this to kind of go by the wayside and remove all restrictions. And here I'm just going to get into some prominent themes that rose to the surface when reviewing the comments. People just, they really acknowledge that this is a very, very difficult space that we're all trying to navigate with the information that we have at hand. So people definitely discussed the difficulty of finding a safe and healthy balance between supporting local public health and supporting the local economy. Kind of, and these are my words, I framed it this way, but it really felt like that expression that people are kind of between a rock and a hard place here, where people understand more restrictions would really benefit public health and individual health, but it would also be, could be a very significant detriment to our business owners and the staff that, are employed at those local businesses. And we heard a lot of this over and over in the comments. People in the business sector or, working as essential workers, well, at the grocery store, the bars, bars are not essential, but you understand what I'm trying to say. They're very much like they're supportive of public health and they want to do the right thing, but they are also trying to balance, serious financial circumstances. And the reality is a lot of them are saying, a stay-at-home order or more restrictions would probably be very beneficial. But at the end of the day, we need to pay our bills. We need to be able to provide for our families. So I thought that was important to highlight. Another thing, and this kind of goes to what Ellen and Shannon also alluded to, bar and restaurant owners and staff, they were advocating for restrictions promoting public health, but they also wanted to kind of keep the door open for having conversations around maintaining their normal hours of operation. So are there any creative workarounds where we could promote public health, but also keep an eye to sort of the health of the economy? And then a lot of other comments they kind of included information about the public school system, particularly K through 12. I think there were maybe 23, 25 comments specifically that they advocated for increased restrictions, and they also noted, hey, we really, really want the schools to stay open. Please try and do whatever you can do to keep them open. And then finally, we had several messages from student athletes and their parents advocating for maintaining the current restrictions while allowing for student sports to continue as usual, but having more safety planning and coordination between the health department, athletic teams, and the stakeholders. That might be perhaps maybe stakeholders being organizations that they own the fields or they manage the fields or the rink or what have you. And this particularly, the messages that came into us were actually from the hockey team, which I now understand is not technically a school sport, but it is a school-aged sport that a lot of students participate and engage in. Okay, so wrapping it all up here, in general, the comments submitted and presented in this presentation, they are supportive of the Board of Health adopting with revisions the October 27th Health Officer Order. To remind you, 70% of the 251 comments indicated general support for this. 43% of 120 comments that were specifically related to yes, we support this. They actually indicated something for closer to a stay-at-home order. And then hopefully you can all hear me. I just got a notification that my network is spotty or my connection is spotty. But lastly, I'll remind you that 23% of the 251 comments indicated they did not support the board adopting with revisions the health officer order. And wrapping it up, I just wanted to thank you. I wanted to thank the board. I wanted to thank the health department staff, and I wanted to thank the community for their civic engagement and sharing their voice. And I wanted to remind folks that public comments submitted to the health department are public information, as we are a government entity, and the information or comment related to this specific Board of Health agenda and action item is available to the Board of Health directly, and it will also be made available upon request by media should they ask for it. And so with that, I'm going to stop my screen share and pause for the cause and see if we have any questions, or just turn it back over to Ross to continue facilitating.
Yeah, thank you, Mary. Yeah, we'll open it up for board and staff questions and discussion right now. Public comment will happen after that. So right now it's just open for board and staff comments and discussion. So, Mary, if you could stay available, and Shannon and whatnot. So any questions or discussion by the board?
So this is Pam. This is a question for Shannon. Shannon, what events are you seeing plans for groups larger than 250 people? And how many of those requests have you received?
Yes. So Mary, I think you have to stop sharing your screen. So the types that we have gotten for over 250 have been, recently we have a couple of Parade of Lights kind of events that probably will take place mostly in vehicles. There's a Goodfellows holiday meal where they're going to serve, I think, between 400 and 500 meals on Thanksgiving to people who otherwise don't have a place to have Thanksgiving. There have been a fair number of sports. So the football, high school football, and we've had golf and fall soccer at the Y. So as an example, when we look at an event, we look at it over how many people are going to be there over the course of the entire event, and the event might run a number of days. And so with Y Soccer, even though they're like little small groups of people that are interacting, we looked at the whole thing and how can they manage the whole thing in a way that will meet Appendix A and keep people distanced, etc. And then we've had some market type things. So of course the farmers market was over 250. We've had the winter market, and there's the Little Red Truck Market, and there's the Maid Fair, although I think some of these might have decided not to go forward. I don't remember about the Maid Fair. And then some commencements were over 250. And then Imagination Recycling. So they have glass recycling, and they thought that they might have more than 250 people. At least that's what they were planned for. But you can see that in a lot of these cases, sports and the commencement accepted that it wasn't 200, or it wasn't 1,000 people all there at one time. And so for the number, that's a little harder for me to give because I didn't do that. I can certainly look that up. But what I can tell you is that we have reviewed about 240 events, or are reviewing about 240. I mean, we have either reviewed or are still reviewing a total of about 240 events. By far and away, most of those are between 50 and 250 people, and now 25 and 250 people, and a smaller subset is over 250, between 250 and 1,000. 3, 4, 5, 6, 7, 8, 9, 12, 13, 14. So I would say from what I was looking at today, it's about 20 that were over 250 people.
Okay. Do we know if there's been any connected outbreaks to any of these larger events?
I don't have that information, so I'll turn that to Ellen. But before I do, I do want to say what we aren't getting is complaints. And so there was one wedding early on that tried to figure out how they could have more than 50 people when that was the number. And that kind of fell apart. And so after that venue was like, yeah, we're not going to do that anymore. Because places, like weddings, memorials, those are really hard to keep people apart because of the type of celebration that it is. But other than that, we just are not even getting complaints. And we've gotten over 1,600 complaints since the mask order went into effect, the first one in July. And so that is saying something.
Yeah. Thank you.
Yeah.
So I guess the short answer is the storyline through our case investigation of spread is very much the unstructured, it's either familial, it's, we know our family's going to get together, or you live in the household. It's pretty hard. You got a good 50% chance of, if somebody in the household has it, of somebody else getting it. But they've largely been family events, friend to friend, co-workers, usually when related to, they keep their masks on and do everything at work, but they happen to also be friends and go out after work, take breaks. We've also noticed that in the structured school and university environment, that the number of cases, especially if you look at it in a sort of an incidence fashion and compare it to the communities, the cases they're dealing with and the time loss they're dealing with are quarantines related to spread from outside of that environment and then trying to keep it from spreading in the school environment. So we generally are seeing that this approach is doing two things besides the protective aspect of it. It's changed the expectation and the culture in the community. And I think you only need to walk into another community and see that. The other thing I want to emphasize is, Shannon said it, but I want to emphasize that an event could be happening over like a whole day, or like the winter market, several days. And so the idea that you're going to have 250 people all in one place at one time is usually not what we're looking at. I think the only time we did that was high school graduation, and that took place in the Washington Stadium, so they were spread out. And we've mostly seen, really the largest and I think most creative thing that I've seen was what was happening at the ball field all summer. You came in with a pod. You couldn't come in and wait for your friends inside. You came in, you bought a little square that you sat in, you wore your mask even before there was a mask rule. So we've seen a lot of that. Can I say there's been absolutely no spread from many of those events? No, but I can tell you the preponderance of spread is not what I call stranger danger. It comes from, it's more friendly fire. That said, people because you think, well, nobody would give you a disease, and you wouldn't give it to them, but the virus isn't thinking that. That said, there is evidence coming forward about places, particularly that you may be in, where there's a high density of people, even if you're attempting the 6-foot distancing, so such as large grocery retail stores. So there's that kind of, you really don't keep your 6 feet, and you've got a large number of people in there at one time, even if they're masked. And restaurants, there's, again, this is emerging epidemiological evidence, and science will continue to emerge in places where masks are necessarily removed. So restaurants, bars, gyms, those types of things. And yes, of course, sports. There's different levels of risk related to sports. Golf, if handled correctly, isn't particularly risky. Some of the higher full-face contact sports and sports in which there's traveling teams, we have seen cases and large quarantines from those. What has begun to change, which is both on the, I'd say, positive column and the not as positive column, is that many sports are moving indoors. Some were already indoors. So indoors can generally be riskier. And then when you get to the test availability and requirements, when you get up to the college level, of course, there's tremendous requirements for testing. I'm not suggesting that sports aren't risky, but I am trying to talk about what mitigations are available for sports and also answer your question. So protected environments with masks have shown locally to not be the site of clusters and spreads.
Thank you.
Thanks, Ellen. Shannon, I have a question for you on Appendix D. So is it my understand, the way I understood it, the seating section in Appendix D, as proposed on November 18th, we would, on the first bullet, we would strike the second sentence of the first bullet. Am I understanding that correctly?
Yes, that's our request.
Okay. All right. Thanks. That was all I had on that. Any other board questions or discussion?
Yeah, hi, this is Amber. Cheryl, I have, I'm just curious, and I appreciate Mary's comment about a rock and a hard place, because as we all keep thinking about this, and there is an aspect of mental health, there's an aspect of our economy, and there's our physical health, obviously. So these are all hard. These are all hard decisions and discussions to have. But my question, I guess, is with the removal of the requirement for standing and ordering at the bar, could some, and I guess I'm curious, as we're trying to, what the thinking behind removing that was, and also, is that, I mean, is that a big financial hit to have that to these places? I'm trying to balance what the health and financial aspect of this is, because when I originally read that seemed like a reasonable requirement.
I'm going to jump in even before Shannon does on that one. And it's a fair question, and it is in front of you, and if it wasn't, you might have brought it up. But that was removed as part of a number of other, a package of things that we thought could make it safer in the bar in general, and allow that after 10 business hour to go forward, in order to, at a time, depending on the time of the day and the bar and the size of the bar and the revenue, and of course we're looking real hard at local businesses. So it was a mistake that it got left in Appendix D when we brought it in front of you. That's the first thing I want you to know. It's not in the health officer's order. Why are we saying at this point, take it out? One of the considerations is, in some instances, you would then have to have another staff person in the bar to do all that table service. And with the bars running as tight as they are, cutting into what is their biggest time of revenue generation, they may just have a bartender. So that's really important and unfortunate. I'm sorry that we left that in there, but that was only put in there when we thought that they would actually be able to stay open more, and possibly in the busier times have another staff person that they could afford to do table service like a restaurant.
Yeah, and if I could add to what Ellen said, I think that's really important about the later hours. And so really, when we went out to bars and places that were serving alcohol, the time that we saw the biggest problem was after 10. So when the bars started getting more crowded, and so one of the problems is that right now, by the governor's directive, everybody in the bar has to have a place to sit. And so there actually is a requirement that when you are in a bar, you are seated when you are drinking and you're staying with your group. But the concept of not going even up to the bar to get a drink would be to take away the possibility, or even just kind of what would naturally happen as it got later and later and later at night, that people wouldn't return to their seats and would just strike up conversations because they were in and kind of clump together and start mixing with groups, which is what we were seeing. So it really was an after 10 mitigation measure.
And I would add that there are, some restaurants that you go up and place your order and then you sit down to. So that's why it's an error. on our part that we left it in. We took everything else out.
Okay, thanks. I think that's my only question right now.
Any other board questions or discussion?
Ross, it's Debbie Johnson. It's not a question, and just more of a comment. I just wanted to express my appreciation to the restaurant and bar owners group, working closely with the health department to develop a plan that was really right for Missoula. We sort of got trumped on Tuesday with from the governor's announcements, but I just did want to express the appreciation to the licensed community and everyone at the health department working really closely to come up with what was a really great plan collectively, and just appreciate all of that. And there's a lot of chat in the chat box and discussion here too about the mental health aspects and the mental health positive effects of connections and relationships and being able to be out in the community. And I think that we've worked really hard on a good plan and hope that that this will be positive in bringing down the numbers in our community. Thanks, Rob.
I would like to add to that one of the a part of the governor's announcement was to try to have money for small businesses, which of course was available. Not that things were peachy in the first shutdown when we didn't have many cases. And as I just all are aware, we don't know when Congress, if or when, is going to let money. And so the governor did talk about finding some money for small business, and we'd be glad to join in any way following up to make sure that small businesses of all types, including bars and restaurants, and I know the mayor has mentioned to me to make sure that what he did find available reaches the people who need it.
All right. Thanks, Ellen. Any other board questions or discussion?
Ross, this is Josh. I just had one I wanted to ask Ellen about. That's all right. From what Ellen was saying, it does sound like structured spaces are more safe than unstructured spaces. Is there anything our health department folks think we can do to push people toward those types of spaces that we have not yet been doing in terms of messaging or other groups we can engage? Any thoughts on that? Thanks.
Well, we're sure open to more ideas. We meet weekly with a small business group, and I think the schools have just done an amazing job. So we're open to ideas on that. And the best thing that people can do, which they are doing in this town, is making the structured places available that we do have, having them out there. They're not easy. And there are other towns that have just said, $250, that's it. We don't care what you're doing. And I think that making those available is, when people want to get out, then they have a safer place to go do it. So we're open for ideas. At the same time, I have to warn all of us that, the cases are still going up. And we have an awful lot of change in front of us between now and, the changes at the federal level, the state level. While all of those changes are, I think, slowly happening, the cases do continue to rise. And so we have this almost, maybe 2 months before there's a chance of money for businesses and people, and maybe 5 months before we actually start seeing vaccines. So we have to think, how do we cope with that? And we have to think kind of over the long run, because the type of shutdown that we experienced before, I don't know when you pull the trigger on that. To tell you the truth, you try to stay away from having to.
And if I may, the other thing that I would say, it's like a completely different angle than what Ellen was just talking about, is that through our event review, there are a fair number, and I could get the number for you, but there are a fair number of events, people that we've talked to that make decisions not to go forward with the event because it's just not possible for them to they just don't want to put everything that they have to put into it to make it highly structured, or they can't, or the venue won't work right for that kind of thing. And so that's the other real benefit, I think, to event reviews, is that it helps people come to terms with sometimes it's just not easy or possible to make an event a safe, structured space. And so that event then doesn't go forward this year.
All right, thanks Shannon, thanks Josh. Any other board questions or discussion? All right, hearing none, let's go ahead and at this time open it up for public comment. And Julie, this is where I'm going to need you to kind of help me navigate through this. I see a hand popping up with Erica Peterman. Erica, go ahead.
Can everyone hear me? Not that I can see anyone. My name is Erica Peterman, and I'm here on behalf of Revive Missoula Bars and Restaurants. And Revive Missoula Bars and Restaurants, which I'm just going to call the Alliance right now to save time, is the group that everybody has been talking about today. And it's an alliance of over 70 Missoula bars and restaurants that have come together to kind of ensure safety standards within the members of that group. And the other purpose, and I would say the main purpose, was to work with the health department to come up with ideas and high-level kind of safety precautions that worked both for the Missoula restaurant and bar industry, but also for the safety of Missoula and the health department and the Board of Health could get behind. And so for the last week, or at least up until the governor's order, almost right up until the governor's order, we were working on what those recommendations could be. And those are the recommendations that you have in front of you right now. And the only change that I would make to those recommendations, and I'm not sure if we were going to get there, but it would be one change that I would make if you were to adopt them in the future, would be that the closing time would be consistent across boards and restaurants. And so right now there's a difference between the 11:30 time for bars and the 12:30 time for restaurants. Some of those bars and restaurants close, or some of those bars and some of those restaurants serve alcohol and vice versa. And so we would just request that there just be a hard midnight closing time. And so both bars and restaurants need to cease service of alcohol by 11:30, but all bars and restaurants would close at midnight. And that's just to prevent, I think, confusion from both the community, but also so it's consistent across both bars and restaurants in Missoula. But that would be the only change. We worked so closely and so hard with Shannon and Ellen and everybody. And I think that we have at least achieved the goal of creating a really good working relationship between the bar and restaurant industry in Missoula and also the health department. And I think from the bar and restaurant standpoint and the Alliance's standpoint is that we're living in such a challenging time. And I think that the bar and restaurant industry has probably been hit the hardest. And to the extent that we could provide that group clarity, understanding that if numbers increase or they start doubling like that, if that happens, it's a different ballgame. But if things are staying and hopefully numbers are continuing to go down, that we would have some consistency and that bars and restaurants could kind of know what to expect over the next few months. And I guess my position is we're going to have a very different administration starting in January, and who knows what the governor is going to do or what that administration is going to do in terms of their requirements for any establishments being open for however late they're going to be open. And I think that it would give this industry a lot of comfort if we could adopt the recommendations that were sent over by the health department on Tuesday, and we could use those going forward. And and mostly just for clarity and for consistency to the extent that we can have it right now. And I would agree too that, to the extent that we can, our group started a social media campaign today, and it's I learned recently just how big that social media reach is. And our focus is going to be on the safety of these structured places and all of the safety measures that Missoula bars and restaurants are making. And I do think it would be important, we're also going to encourage that people are careful and that people are careful with each other, but also that if we are taking these safety precautions, and I think I've been really impressed with the bars and restaurants that I have walked into. I'm not somebody that goes out a lot anyway, but I have been going and just visiting these bars and restaurants, and they're being so safe. And I feel like the space between tables and the seated serving and everything that they're doing to make sure they're safe is really important, and maybe a message that the community at large isn't getting, and hopefully we can help spread that message. And finally, I guess I just want to thank everybody here. I've been more and more appreciative of our democracy and the health department's willingness to work with us, and we just hope that you can take the recommendations that we work so hard to create and consider them at least for a strong, at least create a strong system going forward that we can all rely on. Thank you.
Thanks, Erica. So just that I understand, and kind of everybody on the meeting understands. So are you, Erica, are you basically proposing that the old version of Appendix D be incorporated into this rule that we're considering today, as opposed to the current version, which is dated November 18th? The reason I'm asking that, because the current version of Appendix D that we have shows a closing time of 10 o'clock to be consistent with the governor's order.
Oh, I'm sorry. I'm talking about the health department sent over their clarifications and recommendations on Tuesday, the 17th. It would be that version of Appendix D. And then also including the hard 12 o'clock closing time with sales of alcohol ceasing at 11:30.
Okay.
So I don't know if that's the new version or the old version, but I guess the most recent version that we had agreed to prior to the governor's order.
Okay. And just thanks, Erica. And that's what I understood. But just to be above board, the current version of Appendix D that the board has in front of us is dated November 18 and has a 10 p.m. closing time for all bars and restaurants. And Shannon, maybe I could ask you to jump in on that and clarify that and add to it if you need to.
Sure, and I'm this is part of the everything is happening so fast problem. And so Erica, I have to apologize. I did not send you the newest version of Appendix D.
Oh, shoot. Okay.
Yeah, that did incorporate the governor's order. And so I think that when Erica and I have been talking, I am pretty sure, Erica, that you and your group are really clear that we have to be at least as stringent as the governor's order right now.
Correct.
But that there was a hope that maybe that could change in the future, whether it's with this administration or the next administration, and then that the health board would consider looking at a more structured after 10 p.m. bar as something that you would be willing to consider. And so I can certainly send the version that the board is looking at to you right now.
That's fine, and I apologize. And honestly, as I was sitting here, I pulled up Appendix D and I thought, well, maybe they're voting on this in the future if things change, and it wasn't anything that I was even necessarily prepared to talk about. But then when you started talking about Appendix D and I had pulled it up, that is what happened. And you're right, of course, like we are committed to abiding by the governor's order and the order that is consistent with the governor's order. My comments were more if the governor's order changes and those rules changes, that we go back to the suggestions that we had come up with the health department and incorporate those into an order that hopefully we can all agree with going forward.
Yeah.
And
Sorry
I think
about that, everybody. I had no idea what I was talking about.
Actually, it's totally understandable. I mean, I just got these various versions of the Appendix D squared away myself just this morning. So it's totally understandable. And I actually think it's probably a good discussion to have anyhow. My guess is that things will be, the landscape's going to be changing in the next few weeks, and we're probably going to be revisiting this. So the idea that we have these discussions now, I think it'll prepare everybody more that this may be a dynamic discussion moving forward. So I think it's perfectly understandable and a good use of everyone's time to kind of kick this around, if you will. So anyhow, with that, any other public comments?
Ross, this is Julie. So Kathy Potwin and I are finding that we're starting to have some problems in Teams moving back and forth between looking at participants versus looking at chat. So we may have to both assist you to identify the different categories of individuals who might want to comment. I can tell you, for instance, that I'm looking at chat. Through the course of the meeting, we've had 4 to 5 people already have typed in some questions in chat, and I can go through and identify them for you one by one. Kathy would need to watch the participant list and identify people who might use the raise their hand function. Neither one of us is able to go back and forth quickly right now and actually have the information populate. So with that said, I know there are at least 5 people who may still have questions they'd like to have answered. I'm not sure how many people Kathy might see who would use the raise your hand function. And before I start calling off names of the folks in chat, for instance, is there a time limit you want to set now for how long their comments can be?
Yeah, we're creeping up on 2 o'clock here, and we have a couple other agenda items to go. I guess maybe if we could institute. Well, let's see, how many hands do we have up? I'm seeing 1 hand up here.
This is Ellen. I'm seeing 2 hands up. I am able to go back and forth, and I do see 2 hands up right now.
Okay. Well, let's go with the hands up first, and let's try to limit it to 5 minutes.
Okay, so
Healy Glesner, I see.
Yes, thank you. Hello.
You bet.
My name is Healy Glesner, and I was just wondering how to respond because I work at Valley Christian, and I just have to deal with a lot of parent questions. And so one of the questions I get often is, if distancing and masks are working, why are the numbers going up so quickly? Even if not everyone is following the mandates, certainly we'd be seeing the numbers stabilize, if not go down with what's in place now. So as we propose to do some more strict regulations, my question is, how do I respond to these people who are not quite understanding how that works? If we have these regulations in place, why aren't numbers going down, basically? Thank you.
Ross, if you're speaking, you're muted.
Yeah, I was muted. Thanks, Ellen. I see another. I see another hand up. Henry Netherland, is it? The name appears in Henry Netherland has a hand up. Henry, do you have a comment?
Yes, hi. I'm from the Sealy Swan Pathfinder. This isn't directly related to the proposal, but we were wondering if you could give us more information about why the health department is suing a cigar shop in Missoula, and if any further litigation will be taken towards any other businesses.
Ross, this is Anna Conley. I think that he's speaking to the next agenda item, which we will be addressing, and it's not new litigation. It's actually quite old litigation that we're resolving and talking to the board about. So I would advise that we hold off, and when we get to that agenda item, we can provide a full update.
Okay, thank you.
Thanks.
Sounds good. Thanks, Anna. And with that's a good segue. That at this point we are just accepting public comments on the proposed board rule in front of us on COVID restrictions. As Anna mentioned, we've got another agenda topic coming up, and there's also always at the very end of the Board of Health meeting, there's opportunity for public comment on items not on the agenda. So just to clarify to all of our public out there that may be wanting to comment, that at this time, comments are limited to the COVID restriction rules. Thank you.
Hey, Ross, this is Josh. I just had a kind of a process question. I'm sorry to interrupt.
You bet.
Thanks. The gal from Valley Christian, can she have her question answered, or is this just a comment type situation?
I would be glad to answer it after the meeting.
Great. Thank you, Alan.
Yeah. And Josh, in terms of process, I think typically we are, it is just that, a comment.
Okay.
A comment question. Anna, if you want to chime in on that, feel free, but that's.
Sure. Yeah, I know the health department spends every day of every week
answering questions
and provide support to individuals who have questions and are looking for guidance. I think it's the best use of this board's time to take comment on the action items before the board. But it does sound like if there are people who have questions, the health department is and continues to be willing to follow up with those questions as requested.
All right. Thanks, Anna. So with that, I don't see any more hands up.
Ross, I do see Will Fesperman.
Okay, great. So Will, if you've got a comment, floor is yours.
Yeah, can you hear me?
Yeah, I can hear you.
Okay, great. Yeah, thanks for letting me speak. And I appreciate the comments or the questions from the board. And I appreciate Ellen's precise and careful kind of just information about what's going on. The last time I called in was the public meeting in October, the last one. And since then, last I checked, 39 people have died in Missoula from COVID. And we all know that the numbers are going up extremely quickly. And we all know that with these current suggestions that are going to be put in place, the numbers are going to continue going up rapidly and people will continue to die in Missoula. And I would like to see a return to a shutdown for now until we can start meeting some of those goals that have been indicated. And I'd like to respond also to people calling about restaurants and bars. I understand the need to protect people's livelihoods, especially right now when there's so much economic precarity. But right now, I think the city county health board needs to focus on health and epidemiology rather than economic issues. That should be the job of the government at the federal and state levels in terms of the city council and people like that. We really need to be thinking about what's right to bring down infections. And I think that it's extremely irresponsible to have bars and restaurants open as they are now. I think you're just putting people's lives in danger. I know I have lots of friends who work in restaurants and bars and they feel afraid. They also feel worried about giving COVID to other people. And frankly, it's not the responsibility of workers. It's the owners of these bars and restaurants who need to really step up and realize that they need to do everything they can to keep their workers safe and to keep the public safe, and that lives are more important than property right now. And I just really think it's outrageous to me the little action that's been done in Missoula. And we can compare ourselves to the rest of the state, but we're in a very red state, so that obviously isn't very helpful. I just really hope that we see some serious action far beyond what has been proposed today. Thank you.
All right, thank you, Will. Julie and anybody else? Julie, do we have any other hands up? On my screen, I'm not seeing any other hands up.
This is Julie. Kathy, do you see any hands up? Okay. I do not see any more hands up. I do know that an individual identified as tech support has made several comments, some of which were questions. So I understand that we're not answering questions during the meeting, but one question that perhaps we would answer was tech support. Are you still wanting clarification as to whether assembly includes churches?
Yes, please. That would be great. Thank you.
Okay, Julie, this is Ross. So do we have any outstanding comments here, either by phone or by chat that are public comments that we need to take in?
Really close.
CJ Otto, do you wish to make a comment? You might need to unmute yourself. CJ Otto had entered some comments in chat about the status of local tavern orders, or excuse me, owners. But perhaps he or she's no longer on the meeting.
The chat says he's trying to call in.
Okay. I'm scrolling, Ross, to see if there are additional. Robin Barker, do you wish to make a comment? And again, Robin Barker, if you'd like to make a comment, you would need to unmute your mic, please. Just as a point of reference, Robin Barker had entered a written comment expressing concern about house parties in which people are meeting after bars close. And yeah, I'm not seeing other comments.
Yeah, neither am I. I'm scrolling through the chat as well.
I see 6 phone numbers.
Yes, and also I do see Craig in chat entered a comment. Craig, if you're still participating, unmute yourself, please, and you can give your comment.
And I'm seeing go ahead.
No, I apologize. I can imagine that you guys have your hands full with a lot of different people trying to comment, and I apologize about the delay. And I wanted to make it perfectly clear that obviously our number one concern is the health and safety of all our fellow countrymen across the world.
And if I could butt in just a little bit so you can identify yourself.
Oh, sorry, CJ Otto.
Okay, thank you.
Apologize. So, again, I want to make sure that that is perfectly clear that, you know, health and safety is first and foremost. And while I can appreciate Ms. Peterman and some of the things that she had said, I understand in a few of the comments that I had left, and I don't know the exact figure, but that small business loan that was available to businesses was negated by anyone who had a certain percentage of gambling revenue attributed to their business. They were non-qualified. And so every bar in Missoula, as you well know, has Keno and gambling machines that make up a substantial portion of their revenue, not profits, revenue. And so one of the things that you look at is they're immediately taken out of the mix for any kind of relief fund. And so with that being said, I think it's important to address that a lot of these tavern owners have had their entire life savings tied into these $750,000 licenses. And right now, I mean, the public could say, oh, well, then get out of the bar business, sell it. Who's going to buy now when you can't even stay open past 10 o'clock? And what I'm asking is the remedies that you guys have thought about or put into place for these small tavern owners that own one, maybe two bars. As I addressed, Lucky Lil's and Town Pump is a huge corporation that has multiple licenses, which will probably survive. But the local tavern owner, what do you guys have in place to effectively save them?
Thanks for your comment, CJ. At this point, is there any other comments that we have queued up, Julie?
We're trying to help Craig unmute his phone so that he can give his comment.
Okay.
So Craig, try pressing *6 if you're on the phone. If you're joined through Teams, you should see a microphone icon. And if it has a slash through it, click on the icon and that should unmute you.
Also, if a person's on Teams and it will not allow them to speak, which once in a while we'll do with a person external to this network, you leave us a chat that you're going to sign out, and you just click back in, and that reboots it.
Yes, hello, this is Craig Moore.
Okay, you're on, Craig. Go ahead.
Okay, great, thank you. I'm calling in regards to the Missoula Bruins hockey, high school hockey. I think you can see there in the chat that we had kind of written down what we were going to say. But we wanted to call because we really want to be considered equivalent to a high school sport. My son's been playing for years and wants the opportunity to see a better future. So first off, we follow all the requirements that the schools do at the rink. And we cannot play through high schools because hockey isn't offered, nor is there any rinks available. So Glacier Ice Rink is the only location for us. And we'd like the board to accept us out as a high school sport so that we can start and play this season. Is there someone we need to contact in regards to that?
Ellen, is that something you can address? Or is this the time to address that, or?
Yeah, I can give a quick sort of status report on that. And I do know that Dr. Stenger, if he was able to get back on the meeting, has concerns about sports from the spread and the hospital capacity perspective, but I can't tell if he was able to get back on the meeting. Actually, the myself as a health officer and the department and my fellow health officers in the large populated counties of the 7 of the state did offer the opinion and the recommendation to the Montana High School Association that they not continue sports in exactly the same way that they usually do, with en masse contact with larger groups and traveling and teams traveling in and out. So it's been the position of the health department that those higher risk sports being conducted in the same way as they usually are. And by that, I mean this sanitizer's good, but it's primarily a respiratory person to person spread. So it's not the, it's not the answer to remove all the risk or most of the risk from those higher contact sports and that kind of travel. The Montana High School Association and the governor determined that they would not follow that advice, and has continued to be a problem both for spread and for the equity issue that you raise. So I can acknowledge that. I don't have an answer for that right now. I am getting more concerned about the spread that we are seeing from those that by the high school association were allowed to continue in a similar fashion to any other year, especially as the numbers go up and a number of kids are either missing school because they have been infected, and then much larger numbers are missing school because they are quarantined, sometimes repeatedly. So that's the position for me as the health officer. And I continue to, I guess, look for a way to try to see that other sports, particularly high school sports, don't continue in exactly the same fashion that they are doing. So what you're requesting at equity is fair, but it is not moving in the direction that epidemiologically we need to move. And this board.
So can I interrupt you?
Mm-hmm.
I'm sorry. So is the only concern the COVID-19, because it doesn't seem like the health department has any concern for the mental health and well-being, and it's not something that can be tracked on the COVID reports, and it's it's just frustrating because there's so much down the line that just doesn't seem to be a concern. And 2/3 of 1% have issues with COVID that are serious, and it just doesn't. I don't know. It just doesn't make a lot of sense.
I guess with that, I just would chime in that this board and the health department is charged with protecting the public health from communicable diseases, and we're dealing with a communicable disease outbreak that hasn't been seen for 100 years. So we are grappling with a very big problem, and we'll continue to do so. With that, is there any more public comments that I'm not seeing here?
There are people on the phone lines so I don't know if you and Julie are planning to go down the phones.
Sure. The next number I see, the last 4 digits are 0138.
This is Julie. If the person is still on with a phone number last 4 digits 0138, you will need to unmute your phone. You can try pressing *6 to unmute.
Okay, the next number, the last 4 digits are 7980. And I see that you have unmuted.
Just to say no comment. Thank you.
Okay, the next number I see is 1101. Okay, the next number is 7566. Next number is the last four digits, 5568. Then I have one last number. The last four digits are 4136. And those are the only telephone numbers that I see right now.
All right, thank you. At this point, we will then go back to the board and determine whether or not there's going to be a motion to adopt this rule, or whether we want to deliberate on it further. So I will open it to the board for either a motion or discussion on whether to deliberate further.
This is Pam. I move that we adopt.
Thank you, Pam. And just to be clear, is that to adopt? The only change that I am aware of to what we have in front of us would be striking that sentence in Appendix D, and of course the Appendix D that's dated November 18, and that would be striking the second sentence in the first bullet under seating. Is there any other changes or amendments to the proposed rule we have in front of us that anybody's aware of?
Nothing from staff.
Okay, so now I'll open it up for board discussion on the motion. Any discussion on the motion?
Ross, this is Amber. I'd just like to make a comment, I guess, just listening to some of the public comment and thinking about the discussions that we've had, and your comment of we haven't seen something like this in 100 years, these are unprecedented times. And, I think that as a board that we are going to need to be willing to look at changes like this and reconsider decisions and be nimble, so to speak, as we move forward and as more data is out there. We are in a situation that we have no federal stimulus. I kind of want this on the record as for the public and for the press that there's no federal stimulus. We are fortunate that our governor gave us some type of money for businesses, for those that are unemployed. If we don't have any money along those lines, it does end up having to be a balance of, as a city council person, I'm thinking about our homelessness problem, right? I'm thinking about all the other things that we are potentially going to have to, deal with. And, businesses going out of business and not having those employees not working and not having extra unemployment money. I mean, there are no easy or it's kind of the hate to say this, it's the worst of the bad option or the best of the bad options. So, not having federal money puts us in a very, very different position than we were the last time we locked down.
Yeah. Thank you, Amber. Any other comments or discussion from the board on the motion on the floor?
This is Pam again. I just want to say that I agree with Amber in that I feel that we do need to be flexible. I do think with a change in our state administration and our federal administration, we are going to see changes to the current orders that are in place now. And we will need to adapt our community to those things. So just knowing that if we do accept this order now, does not preclude changes in the future. So,
thank you, Pam. Any other comments or discussion from the board on the motion?
Yeah, Ross, this is Josh. I just had one. I just wanted to kind of reiterate that the governor has a new set of orders out there, and we don't have nearly as much latitude as we would have previous to this, and we cannot be stricter than what his orders are. So we're in a bit. We can be nimble, but not as nimble as we might like.
Right. And actually, I think we're in agreement on this, but actually we can be more restrictive than the governor. We can't be less restrictive. But,
sure. Yes.
Yeah.
Yes.
Right.
Thank you.
All right. Any other discussion from the board on the motion?
Ross, this is Rob Stenger. I guess I would just say I am grateful to be in a community where we are taking this seriously and having thoughtful discussions. I am frustrated that we have a menu of really bad options to choose from. I feel like from a science perspective and from where we are epidemiologically right now with the disease incidence in our community, unfortunately, while this order is a step in the positive direction, I feel like we're fighting a house fire with a squirt gun. And I just don't think we are taking sufficient steps to, bring rates down as quickly as they need to come down. Unfortunately, over the next month to 2 months, the projections are that the healthcare system is going to be facing increasing strain, as we're seeing in the rest of the parts of the state. Our hospitals are going to get fuller. We're going to see more deaths over the next couple of months. And I just want to give voice to all of the firefighters and police officers and nurses and doctors and hospital custodians and everybody else on the front line that is going to be caring for that burden in our community, because it's going to get really hard for those folks, even harder than it is now over the next couple of months. Having said that, I think that this is a step in the right direction, but I am concerned that it is not going to do much to really bring cases down in our community, and we need people to continue to do the things that we've been asking them to do all along. I also would echo Ellen's frustration that I think that we have unfortunately been undercut a little bit by the High School Athletic Association, the Big Sky Conference, in terms of some of the places where we might want to sort of more strictly restrict activities in our county that involve a lot of in-person contact, face-to-face, where mask wearing is impossible. Thanks.
Thanks, Rob. Any other board discussion on the motion? All right, hearing none, we'll open it up briefly for public comments on the motion. Again, these are public comments strictly on the motion on the floor. I see a hand up from, I saw a hand raised, now it's down. It went away.
Right.
Oh, and now it's up again. Susan Demarinis.
Hi, yeah. Sorry, I knew with the hand raising. Yeah, I just wanted to reiterate that until people comply with the mask mandate and staying at home as much as possible, your schools closing is going to continue. I mean, you know, we do everything we can to keep our schools open. And we also get a lot of flack for staying in the phase, the current hybrid we're in. And I'm floored that the dots are not being connected. You want the schools open, you follow the mask mandate, you stay at home as much as possible and only go out for essential needs. It's that simple. You want the numbers to go down, that's how it happens. And I'm just kind of tired of the little like tiptoeing around what needs to be done. We want to stay open, but we can't until people start complying. And that's just all I wanted to say. Thank you.
Thank you, Susan. All right, I'm not seeing any other public comment on the motion. So it's ready for a vote.
Whitney's going to throw up.
I just heard.
Oh, I think it was an unmuted person.
Okay, I'm still not seeing any more comments. The motion is ripe for a vote. With the technology, we've learned that it's best if we do a roll call vote. And so I'm going to go around to our board members that are on the meeting and do a roll call vote for basically yay or nay, or yes or no. Yes would be for adopting the rule, and no or against would be against adopting the rule. So I'm going to go around right now. Pam.
Yes.
Amber.
Yes.
Deb.
Yes.
Rob.
Yes.
Okay, and myself, Ross, I'm a yes as well. I don't believe James Stevenson's on the call. I haven't seen him on the list. James, if you've come on, please let us know.
Ross, it's Debbie. Josh is on.
Oh, I'm sorry. You're right.
I was just
Josh.
beginning to take it personally, Ross, and I was thinking you've done such a good job today on a tough meeting. You've really done well. Thanks for remembering me. I'm here.
Thanks. Josh, are you a yes or no?
I'm a yes, sir.
Okay, all right. Well, that gave us some time to. Yeah, that gave us some time to find out whether James was on or not. So, and James is not, that I'm aware of. So the motion passes. Thank you, everyone. It was a great discussion. I know these are kind of challenging issues to get through in this format. They're challenging at any time, but in this format, it adds extra challenge. So thanks much, everyone. With that, we're going to now move on to item number 2.